Dr. Rajesh Mistry. I am Director of Oncology at Kokilaben Dhirubhai Ambani Hospital, and my field of interest is thoracic surgical oncology. November is the Lung Cancer Awareness Month, and since lung cancer is a big problem, it is very important to join hands with a hashtag Cancel Lung Cancer campaign. It will go a long way in helping reducing the incidence of lung cancer and helping patients who have lung cancer in their treatment. Lung cancer is one of the commonest cancers in the world today. In India, amongst men, lung cancer is number one cancer if you take it for a single site. On an average, we see about 60 to 70,000 new cases of lung cancers every year. But more importantly, the number of deaths which occur from lung cancer is more or less equal to the number of new cases that are diagnosed, which means that lung cancer is very lethal. And if you compare the same with, say, breast cancer or prostate cancers, whereas the numbers are very high, the outcome in patients with these cancers is much better when you compare it to lung cancer. So lung cancer, in early stages is very silent disease, like many other diseases. In early stages, lung cancer is more or less asymptomatic. Very rarely patients may have some symptoms, and on imaging you might pick up the cancer at an early stage. But majority of the times, by the time patients have some complaints, the stage for lung cancer is on the higher side. However, the common complaints or common symptoms that one should be looking for is cough which doesn't get corrected with normal treatment. Blood in sputum is one of the important symptoms of lung cancer, though it can be seen in many other diseases such as tuberculosis. Change in voice, loss of appetite, chest pain, difficulty in breathing. These are some of the signs which are associated with lung cancer. But just to reiterate, these signs occur generally when the lung cancer has reached stage which is either 3 or 4. In stage 1, most lung cancers are asymptomatic, and they can be picked up incidentally if a person goes for a routine executive health checkup or gets a chest X-ray done for purposes such as visa or immigration. So when you pick up cancers in early stage, it is generally asymptomatic. Cancers are associated with increasing age. However, if you see in India, most cancers occur 10 years earlier than what you see in developed countries of such as US and Europe. So we in general see cancers in younger patients, and this is the same with lung cancer also. So age itself is not something which will tell us whether patient has lung cancer or no. Lung cancer can be seen in younger patients also, particularly if a person starts smoking early on in his life, because you start smoking, the effects of smoking in terms of lung cancer or any others, bad effects of tobacco are seen after 10 to 15 years. So if a person has started, smoking early on, then even at age of 30 or 40, one can see lung cancers. Yes, but in general, most cancers, including lung cancers, are seen in Indian population at an earlier age. Like all cancers, there are 3 modalities of treatment for lung cancers. One is surgery, second is radiation therapy, and third is medical treatment, which consists of chemotherapy, targeted therapy, or immunotherapy. Now, the type of treatment that a person with lung cancer will receive depends on the stage at which the diagnosis is made. If the patient is diagnosed at a very early stage, stage 1, for example, then the options include surgery, or if the person is medically unfit or not willing for surgery, then stereotactic radiation therapy is also an option. So when the disease is localized early stage, surgery forms an uh, important treatment modality. As the stage advances from stage 2 to stage 3, the treatment becomes more complex. So the treatment will include chemotherapy. It may include combination of chemo radiation therapy before surgery, and then surgery. And in many patients, even after surgery, they may require chemotherapy or combination of chemo and radiation therapy. And once the stage is stage 4, then it is not a stage where cure can be offered. The treatment would mainly be medical, either chemotherapy, targeted therapy, immunotherapy, or palliative radiation therapy. So in any cancer, the prognosis, or what you call survival, the long-term outcome, depends on the stage at which the cancer is diagnosed. So in lung cancer also, if the stage at which the diagnosis is made is stage 1, then the outcomes are very good and the survival could be very good. It could be as high as 90-95%, particularly when tumors are diagnosed with a size which is less than 1 centimeter, 5 millimeter, which happens only when you do a CT scan, even in absence of any symptoms. But as the stage progresses, the outcome, starts deteriorating, and in stage 4, one cannot think in terms of long-term survival. However, there is a lot of hope now because of the advances which have been made in treatment. Patients with stage 4 cancers, those who are lucky to have certain targeted therapies available, or recently immunotherapy, a lot of stage 4 patients also survive, in terms of years, maybe 2 years, 3 years, 4 years also. But on an average, stage 4 cancer patients, the survival is very poor. Diagnosis of any cancer, not only lung cancer, is always a setback for not only the patient but also the family. The commonest comment that I come across when I break the news of cancer, particularly lung cancer, is that I've never been a smoker. I don't even drink tea. I don't have any bad habits, and still I'm getting cancer. And generally, the diagnosis is made at stage 4. So it becomes very difficult first for the patient and the family to accept that person has cancer, and that to stage 4 cancer. So a lot of counseling has to be given. And while you might, softly put in that stage 4 cancer is not curable, we always would like to, give some ray of hope in terms of recent advances which have made possible to, treat patients even with stage 4 cancers with targeted therapy, immunotherapy, and even if the survival may not be very long, the quality of life can be, made comfortable for patients with lung cancer. So, yes, you need to counsel not only the patient but also the family to first, accept the fact that person has cancer, and then to understand that there is treatment available, there is hope even in stage 4 cancers, and then proceed with the treatment. And while the patients are undergoing treatment, there could be side effects related to medical treatment, which will have to be, counseled every now and then. And, you need to have cancer patient survivor group where the patients can talk to people who had cancers, who have survived the cancers, have coped up with complex treatment and come out winner. So there is a lot of counseling required, not only from the oncologist side, but also through various other groups which make things easier for patients while they are undergoing the complex treatment. So lung cancer is one cancer which is actually preventable. We know that 60 to 70% of lung cancers are related to tobacco, usage of tobacco in any form. So if you can get away from tobacco completely, we can actually have 60 to 70% of lung cancers related to tobacco completely eradicated. Those who are smokers, current smokers, they know they need to give up smoking, because smoke quitting smoking or tobacco in any form at any time will help in reducing the risk of developing cancer in subsequent years. Also, those who are smokers, one need to undergo regular screening with a low dose CT scan of the chest, because even in absence of any symptoms, particularly people who are long term smokers, screening with LDCT is known to reduce the mortality from lung cancer. Lung cancer is preventable, and for people who are smokers, they should quit smoking. And those who are long term smokers, they can take preventive action by getting themselves screened with a low dose CT scan. This way, we will be able to take the hashtag cancel lung cancer forward. Thank you.